The theme for our forum is Unmet Needs and Challenges in Access to Treatments in Europe, the case of chronic kidney disease.
I want to start by saying that the new EU for Health programme is a paradigm shift when it comes to approach to health. It's a testament to the historic level of ambition that this Commission has placed on health matters. And this programme will give us the foundation we need to build a strong and robust European health union. It's going to allow us to increase the exchange of best practices between EU countries and to support networks for knowledge sharing and mutual learning.
If we want to slow and prevent the growing burden of chronic kidney disease while improving quality of life, all kidney replacement therapies options must become available to all patients. Cost-effective therapies exist, such as home dialysis, transplantation, or secondary prevention, but choosing the most appropriate therapy is not possible for all patients in Europe, which leads to significant disparities in availability and accessibility across countries and specific social groups.
In particular, I would like to highlight the need for EU coordinated action in the field of organ donation and transplantation. Kidney transplantation is the gold standard for treatment of chronic kidney disease. The delivery of this treatment option in Europe has greatly improved during the implementation of the first EU action plan on organ donation and transplantation. Building on this success is essential.
But above all, what we need is awareness of the general population and of the policy makers, because there is still a lack of this awareness. And that is the reason why with ECHA we decided to join this Decade of the Kidney, which is a splendid initiative from the American Patient Federation, which is running from 2020 to 2030, where we want to create an increase in awareness on kidney disease so that we come to a similar situation as has been done with cancer over the last 30 years, with a really splendid effort that has been done by the European Union. I thank you for your attention.
This is why we need to invest in smaller dialysis machines that are truly portable, yes, even wearable, so we don't have to waste so many resources by patients being tied up in one place while they're doing their treatments. And this is where we have had the biggest problem so far. While virtually everything has gotten smaller in the past 50 to 60 years, dialysis machine has stayed the same size or sometimes even gotten bigger. There simply has been no incentive to invent smaller machines. Manufacturers and healthcare professionals have seen no point in it, and patients apparently have never really been asked.
Let's close the poll now, and I'd like to see the results. You were given 5 options to choose, and we asked you what would you like to see achieved at the end of the 10 years. Now, clearly there's a lot to do, but I can see that the number 1 is home therapy defined as the first-line dialysis option. That's got 31% of the votes. That was followed by health professionals and patients, fully educated and informed about the different treatment options. That got 21%.
And of course, we would love to increase the access to the kidney transplant, because it's the best kidney replacement therapy, and we see a lot of inequities in the access across Europe, and we need to improve that with data, with the best practice, with protocols.
In chronic kidney disease, of course, primary healthcare has a very important role to play. First of all, in early detection of the problem, because that's a very simple thing, and the family physicians can do it at a primary care level every day. It's looking at patients, it's simple blood testing and analysis of urine, but certainly the most important thing is to really discover those patients that are at risk. And of course, patients with diabetes, with hypertension and obesity are 3 groups of patients that we meet every day and that we should look after in order to see if they are not developing problems that can be indications for chronic kidney disease.
And it's not just about having a choice and making a choice, but it's also about implementing the choice. If the patient chooses a home-based modality, then we should offer the patient optimal training, but also patients in center hemodialysis are in need of training. So we have gaps in relation to involving the patient in the decision-making process, but also involving the patient in their health and also involving the patient in their care and treatment.
Let me first emphasize that health economics is about health and economics. It's not only about economics. And the challenge of healthcare system is to optimize the health of the population within the limits of the available resources. So cheaper is not always better. Sometimes we see that there is a treatment option that is more expensive than another one, but relatively offers a lot of what we call quality adjusted life years. And if that ratio between the cost of that investment and the health benefits for the patients is an acceptable ratio, then we have to go for it. We have to invest in that treatment option. Let's never forget, the goal is to invest in health. Healthcare is not a cost issue, it's an investment, and that's something we should never forget.
But what we can do is, as you say, we can help exchanging best practice, we can help exchanging expertise, and we can do things together with several member states, which are easier to be done together than to be done alone. But the motivation to do it clearly needs to come from member states.
First of all, I would like to start to ask that the European Union or the European Commission puts kidney disease in its priority list of healthcare problems to be dealt with. You can find the whole list on their website, but there is not chronic kidney disease. There are a lot of causes of chronic kidney disease, but chronic kidney disease is not there.
My one takeaway from this is I would go away and call all innovators out there, people who do health hackathons and others, to say we have to liberate kidney disease patients from the wall and from those enormous machines. There is a huge potential out there, and it really needs to be met.